Good time of the day. The question we got today, I'm in pain, I'm overweight, I tried to lose weight unsuccessfully. What can I do?
Hello, my name is Zerniel Allen, and I've been a patient with Dr. Margolin for about 4 years, and he's been very helpful with me with my pain, and I appreciate him very much.
Dr. Margolin is a big help. He has been a great help. A lot of things I didn't know that could contribute to hurting, joint pain and all of that. As far as your diet, he has educated me on that. I have been coming here for, I don't know how many years, but over 5 years, and he has been a big help.
My name is Gina Weinstock, and I just recently started seeing Dr. Margolin, and he has been a godsend to me. On my second visit here, my pain has been reduced, I would say 90%, 95%, and I would highly recommend him to anyone suffering from chronic pain.
Well, the first point that I'm trying to make is you're not alone. Many people who try diets of different types usually found the diets are not well sustainable. In other words, some diets are just goofy, they don't work, but those that do work are not necessarily sustainable for a long time, and you need lifelong plan. Now, another point I want to make is that it's a good idea to lose weight if you're overweight and you're in pain, you have arthritis or pain, what we call degenerative pain, nociceptive pain means wear&tear injury, disc problems, joint problems. You would usually benefit from losing weight. Mostly if you have joint pain like knee joint, hip joint, shoulder joint, but low back pain also to a significant extent you would benefit from losing weight. Now, what you can do if you cannot lose weight? Well, let me make a point. Actually, definitely people with low BMI is body mass index, people with low weight usually do better with arthritis, usually. However, there is certain percent of people, very interesting, so-called quotation mark healthy fat, that seems to be obese or overweight, and they're not in pain and they do well, and they generally seem to be healthy, and the risk of diabetes and cardiovascular disease do not seem to be increased. Now, it's far from being a majority. There is debatable maybe 10, 15, 20% the most. The minority of overweight people don't do too bad, let's put it this way, and some small minority even do do not worse than skinny people who are not overweight. So what is the difference if you look at this so-called healthy fat people? You may notice something very unusual. This is imaging of hip joint, right? These are hip muscles. I'm not going to go into a lot of anatomical details. White is fat. White is fat, and dark black is muscle. Now, if this person here on this side is healthy fat, and this person is a regular overweight person with so-called unhealthy fat. So if you look very closely, you will notice that this person, again, I don't recommend eating steak, but I'm sure people have seen steak and some unfortunately ate steaks. You see that it has marble appearance. There is white between the dark. You see that here much more than here. So healthy person, healthy fat so-called person, the fat is around the muscle. And unhealthy fat person, the fat, the white, is in between the muscle fibers. It's also around, but it's much more in between muscle fibers. Just look, this is marble appearance, this is not so much. Healthy, not so much marble appearance, the unhealthy marble appearance. marble steak appearance. What does it mean? If you go back to the video that we made about sugar, you will see that sugar causes fat to precipitate inside or between inside muscle cells or between muscle fibers. And that's the cause of insulin resistance. That's the cause of what we call storage metabolism. In simple terms, that's basically put you in storage mode. You don't want to exercise. Very hard for you to make yourself being active. It's like, as I said, you put your car in parking mode or reverse mode, and you try to push it forward. Very, very labor intense. That's why so many people fail with exercises. But if you move it into drive, it's just small push and, it runs. So you want to switch your metabolism as if you put yourself in the drive mode. And that you achieve by avoiding this marble appearance, the fat between muscle fibers. How you do that? The first culprit is obviously sugar. And the second culprit is oil. Even healthy oil like olive oil in excess may cause this effect. Just cut on oil, cut on sugar, and generally plant-based, low-inflammatory meal choices. I don't want to call it diet because diet associated with something like, torture program. And some people have even post-traumatic effect after dieting. They succeed, they don't succeed, but then they fail in the long term and they feel bad. And then it creates some kind of vicious cycle. So I don't call it diet. If you want, call it positive eating, meal choices. It doesn't mean you weigh yourself. It doesn't mean you key or concentrate on weight loss. It means you concentrate on making right meal choices. Look at our previous videos. Again, in a nutshell, no sugar, no dairy, no red meat, 70-80% plant-based, maybe here and there chicken and fish. If you really crave dairy and meat products, you can use substitutes just like cheese, almond milk, Beyond Meat, or some kind of Impossible, probable, whatever it is. I have no commercial preference. Imitation products in moderation. They're not healthy. They're healthier than real meat or milk products. In other words, you concentrate on eating well. You also concentrate on consuming turmeric, ginger, and clove capsules. They're anti-inflammatory. And don't concentrate on weight. In 3 to 6 months, either the weight will improve, and even if it improves partially, even don't improve, your inflammatory state will improve. You will switch from this state, which is bad, to this state, which is much better, and your general health will improve. Thank you for this question.